Hello, welcome to my presentation on the Postdoctoral Residency Program at Psychology Specialists of Maine. My name is Kate White, and I am the Director of Training and the Chief Clinical Officer at Psychology Specialists of Maine. And I'm creating this video today to give you a little bit more information about our residency training program, answer some common questions that come up, and just to talk a bit about PSM as a whole, as you might be considering our site for your residency program. So I'm going to start with an overview of our program aims and training objectives. So really there are three things that we're thinking about for our residents throughout the training year. First and foremost, we really aim to train competent and skilled generalists. So as I'll talk about in a moment, our practice is a large group practice, and we see sort of a wide range of presenting problems, but really the common things that you might see in an outpatient private or group practice setting. And so we pride ourselves in really having our postdocs feel competent with seeing a wide range of presenting problems and from different kind of treatment approaches to meet the needs of the sorts of clients that you might see in a private or group practice. So by the end of the training year, our postdocs really feel ready to launch off into a range of independent practice settings. Secondly, a big focus of our training year is to encourage development of your therapist identity. So I think a lot of folks come to us having done a lot of work around the nuts and bolts of how to do therapy, and certainly we'll support you in that even further through the training year. But this is your last experience really to get supervised clinical practice before launching off into your career, and a big part of that and sort of the long-term happiness as a psychologist has to do with developing your identity as a therapist, exploring how that intersects with or builds upon other identities that you have, and generally coming away with a sense for kind of who you are as a therapist, what's important to you, how do you like to work, what sorts of maybe client populations do you like to work with, things like that. So we develop this in many ways throughout the training year, including things like in your supervision discussions, but also in bigger discussions with other members of the postdoc cohort or other people who work at PSM. And then finally, as I said, right, this is the last year of supervised training. So third aim really is to build confidence. We want our postdocs to graduate from our training program feeling like they have what they need to feel really confident in the work that they're doing, whether that is in kind of broad assessment, so things like kind of intake evaluations and treatment planning, but also, of course, intervention, and feeling like you have a number of different ways that you can work with clients that you feel confident in. A little bit about Psychology Specialists of Maine. So we are a large group practice. We are multidisciplinary, meaning that we have a very large group of psychologists that work with us, but also a growing group of psychiatrists. We are multi-site, so we have sites currently in Portland and Brunswick, and we are an outpatient group. So all of the people that we work with are on an outpatient basis. We offer individual, couple, and group therapy services, quite a wide range there of offerings within each of those categories. All of them are for adults, so we are working with people who are over 18 throughout the practice. We also have a number of centers that really reflect areas that we've put extra effort to offer services. And these represent in particular needs that we've noticed in our community, maybe areas where services are short or people are just having a lot of need. So we have 4 centers. Our Center for Education is really for other mental health providers throughout the state. So we are a leading provider of education and continuing education throughout the state of Maine to mental health providers. We also have our Center for LGBTQ Community Supports, and this is going to be really a range of outreach and also treatment services that we offer to the queer community. Again, a place of a lot of need within the state, and making sure that we're kind of keeping up with the need there. Our Center for Psychiatry is going to be our group of psychiatrists. There is a shortage in many ways of medication providers throughout the state, and so we're really happy to be able to offer this service and to be able to do it in-house. It means that a lot of our psychiatry kind of overlapping clients or patients were able to very easily collaborate or communicate with the psychiatry team and make sure that we're covering all of our clients well. And finally, we have our Center for Relationships, and this is a center that focuses on couple therapy through things like workshops, intensive couple therapy, regular kind of weekly couple therapy, and other ways to provide couples resources to the community. I put our mission on the slide here. I think this is helpful for everyone to see. At PSM, our mission is to learn, grow, lead, and inspire others to believe in themselves and to live to their fullest potential. We aim to promote mental health, social justice, and well-being by emphasizing individual strengths, empowerment, anti-racism, and the centrality of relationships. These principles guide us in many ways and sort of many decisions that we make at PSM, and they're absolutely a part of our training program as well, and really trying to, again, kind of support the growth of our residents and help them find ways to practice that are aligned with their values and interests. So I've got some information here about our program curriculum. So these are going to be the sorts of training experiences that you can expect if you were to work with us at PSM. So we have a lot of clinical experiences that are available, including just some core training opportunities. So everybody who comes to work with us as a resident is going to have a varied caseload of individual therapy clients. And as I was saying before, really we are a generalist practice. We see people coming with all sorts of different presenting problems. And so we really want our residents to feel competent, like the sorts of things that would typically kind of be seen in an outpatient private practice or group practice setting. You feel comfortable with being able to work with those sorts of cases. Additionally, we do have a training track that is focused on providing EFT or emotionally focused couples therapy. And if you choose to, or if you are applying for this track, then part of your clinical hours are going to be devoted to seeing couples. We kind of start slow and then increase slowly through the year. So you might be working with 2 to 4 couples over the course of the training year, as well as attending didactic training meetings that are really aimed at the EFT curriculum. This is based on the training curriculum that is part of the certification process for EFT. So by the end of the training year, you'll have a whole lot of foundational knowledge about how to practice EFT and a lot of supervised training experience there. We also have a growing specialty at PSM in group therapy. So we have DBT skills group, ADHD skills groups, trauma-related groups, and others, really depending on what our staff are currently interested in offering. Sometimes we'll have things like process groups or other more kind of targeted content area groups. And we really encourage our residents to co-lead groups with our staff, if that's an area of interest for them. That's a great way to get a little bit of diversity in your week, not seeing only individual clients, but doing some other sorts of work. And, depending on your interest and later in the training year, we are able to also do, a postdoc-led group if there's something that you'd really like to be offering in terms of group therapy. Within individual therapy, I've listed a number of specializations here. Our practice has grown quite a bit. We have a lot of staff who specialize in different forms of treatment. And as you can see, really quite a wide range here. across, CBT, psychodynamic, mindfulness and mind-body interventions, community psychology, social justice informed practice. And so, this gives you a little bit of a sense for the sort of supervision that we are able to offer. And we do work with our postdocs to select their supervisors. So it kind of before the training year begins, I would be sending you a list of all our supervisors with their statement of their specializations and their approach to supervision. And then we can work to kind of make an assignment there based on what you're hoping to get out of your training year. And so we have a kind of an option to either work with you. So you're going to see 2 supervisors at a time, 2 supervisors throughout the full training year, or to switch halfway through. So if you're looking for, again, kind of more of a range of experiences in supervision, then we can do that too. Didactic training, so there's a lot of just kind of weekly support that you're going to get as part of the postdoc program. In terms of clinical skills, we have 2 hours of weekly individual supervision, so one-on-one supervision with your supervisors. We also provide a lot of resources for just general advanced self-study, so kind of a self-paced way to get through additional training material. Furthermore, as part of our Center for Education, we have a lot of clinical training that all of our staff is attending throughout the year. So that includes a monthly Lunch and Learn series, which I have noted here, as well as half-day and full-day clinical training seminars, some remote, some in person. We also have a monthly staff consultation group that postdocs are invited to attend, just to connect with staff generally, but also to be thinking through complex cases and ethical questions, things like that together. And then finally, we also have a professional development seminar series that's specifically tailored to trainees. The topics on that tend to evolve a bit each year, really depending on what people are wanting to get more training in. In terms of the weekly structure, what to expect from our postdoc site. So the position is a 40-hour per week position, so full-time. And we work regular business hours, Monday through Friday. However, we do structure this with a lot of, a fair bit of flexibility built into it. So early in the year, I reach out, or before I suppose postdocs start, I reach out to talk about what you want your work schedule to look like. So if you'd like to have Fridays as a non-clinical day to really do self-study, meetings, finish documentation, things like that, then we're able to accommodate a Friday off schedule. If you prefer to sort of spread your clinical hours over more days, then you can work 5 days per week with your clinical hours. It just sort of depends on your preference. All of our residents do have a private office, and they have access to communal workspaces with all sorts of resources like printers and coffee machines and snacks and all of that stuff. And as I say here, we support our teletherapy resources as well. So we do have a telehealth platform that we use. And I would expect a mix in terms of what you'll see on your caseload. So we tend to have, maybe about 50-50 people coming into the office for services or doing work with their therapist through telehealth. Sometimes a little bit more even with telehealth, it depends. So we do have some options there as well for our residents. If you'd like to have maybe a day or 2 a week where you're doing telehealth remotely, then we can support that as well. In terms of the caseload, we schedule our residents with 24 sessions per week. And that's going to include any mix that you determine in terms of individual, couple, or group therapy. And we schedule for 24, but typically there's going to be maybe a 10% cancellation rate, or maybe you might be down on a case from here and in there. So our residents tend to average about 20, maybe a little bit over 20 therapy hours per week. So, but the rest of your time, you're going to be doing your documentation, your weekly supervision meetings, didactic training meetings, staff consultation, and again, any time that you have that you want to set aside for self-study, learning more about a particular therapy approach, maybe working with a staff member to learn more about an area of their specialization, things like that. And then finally, a little bit more about our program requirements. So over the course of the training year, our residents accrue 1,800 total training hours. We have found this meets or exceeds the requirements in the vast majority of states in the US for licensure. However, if you're considering getting licensed in a state that requires more than 1,800 hours, just let us know. Usually we can figure something out, either maybe extending the work in some time or whatever, so that you're able to meet the requirements for the state that you want to be licensed in. And of those 1,800 hours, a minimum of 50%, so 900 of them, are going to be in direct clinical service. We have a quarterly assessment process where our supervisors and residents both complete some kind of paperwork and ratings essentially on how supervision is going, areas of continued growth and strength, and then have a collaborative discussion around how things are going in supervision. And by the end of the training year, all of our residents to graduate are demonstrating competence in all of our core areas of practice. So this is going to be diagnostic assessment, intervention, ethics and legal standards, individual and cultural diversity, professional and communication skills, professional identity development, and leadership. We consider that when you've got all of those under your belt, you're ready, you're prepared for independent practice. And we find that our trainees do feel that by the end of the year, they're really ready to go. So that's all that I've got for you in terms of this kind of general overview of our program. I look forward to talking more to you about the opportunities we have at Psychology Specialists of Maine. And please don't hesitate to reach out to me directly with any questions that you have. Thank you.